Good morning, everyone. I'm Mrs. Nkwer Abis Aline. I'm a midwife, and currently I'm working with the TB program of Swaziland. I've just completed my bachelor degree in science of nursing with Texila University. I'm here to present to you my research on the impact on patient comfort round on patients in TB.ward at Peak Hospital in Swaziland. Okay, first of all, let's define what is the patient comfort round. What is it? Comfort rounding, sometimes known as hourly rounding or intentional rounding, is defined as a planned intervention in which nurses go to each patient at least every 2 hours during the day and evening to provide care that helps keep them safe and comfortable. And it consists of checking patients every 1 to 2 hours for the 4 P's, which are positioning, potty, pain, and possessions. Research shows that comfort rounding improves clinical outcomes, patient safety, patient satisfaction, nursing efficiency, and staff satisfaction. On the other hand, surveys conducted with nurses and patients indicate that pain management, personal assistance, bathroom assistance, and equipment alarms were among the top 5 reasons for pushing the call bell. In my case, in our hospital, we receive HIV co-infected patients who are coming, they are critical and they need more attention. So one routine round is not enough to meet their needs. We need the PCR, which is the patient comfort round, to address their problems. This study was aimed to identify the use of patient comfort round in the TB ward, to identify the frequency and period when patient comfort round is done, and to identify the impact of patient comfort round on inpatient in TB ward. What was the problem to be solved? Firstly, decrease patient falls from bed, decrease patient unattended death in bed, decrease skin breakdown, decrease and increase staff and patient satisfaction. How was the problem identified? We identified the problem from the patient fall and death in bed rate, the skin breakdown rate, and the patient satisfaction survey results, which was done. The results showed that patient comfort round is done, but not well done. 50% of the interviewed nurses said that the PCR is done, but not regularly. So the nurses are doing the PCR with the interval of 3 to 4 hours, and they are doing it depending on the severity of the cases they are having in the ward. So there are some negative impacts that are coming from that situation. Nurses are experience the following: patient found on the floor, patient discovered with bed sores, patient found dead in bed. And from the patient, there is a patient's dissatisfaction that was confirmed, and nurses' responsiveness to patient call was also confirmed poor and unsatisfactory. So the solutions that existing was the ward normal round done is once per day, and the PCR is done also once per day. But the suggesting solution is that the patient comfort round should be done at least 1 to 2 hourly, coupled with the use of call bell. Limitations to achieve the above solution are in connection with the shortage of human resource and the cost of call bell installation. To achieve all this, the contribution of the government and NGO partners is highly needed. Under the method we use, research design was a non-experimental design. Sampling technique was a non-probability convenient sampling technique, whereby we selected 50 subjects that included nurses working in the TB ward and the patient that was those who were admitted in that department. And the data collection tool was we used a structured questionnaire that was given to the subject, and they answered to the question after we have obtained their consent. And a pilot study was carried to found that the study was reliable, and the data was gathered and analyzed, and we received also a go-ahead from the management of the hospital to continue or to do this study. The results and discussion are based on the question. There are some questions we asked from the patient. Firstly, is the patient comfort round practiced in the TB ward at Peak Hospital? Okay, in this study, 90% of nurses have confirmed that normal routine round is done once daily, and the PCR is done also once daily. And we can see with our definition, the one I told you earlier, that the PCR should be done at least 2 hourly. This can confirm that the PCR was not well done in the TB ward. The second question, when and in which frequency patient comfort round is done? In this study, it's identified that 50% of nurses said that the PCR is done day and night, and 50% again stated that it's depending on the case or severity of case they are encountering, and 30% said it's done every 3 to 4 hours instead of 2 hours. And you can see again that there is a gap between our definition and what is we found in our study. The third question was, does the patient comfort round have impact on patient in the ward? Yes, those negative impact. We have patient falling from the bed. The current study has revealed that events of patient falling from the bed during the admission occur. 80% of nurses admit this fact, and 50% of nurses said it depending of the severity of case. 30% said it is done every 3 to 4 hourly, and 20% said it is done 1 to 2 hours, which shows that the patient comfort round is not regular, and so the high rate of falls. Even by considering the channel used by patients to report their challenges, 45% of them said that they are using call bell to report their challenge. Yet it is known that PCR reduces the frequency of call bell, and 30% of patients report their challenges during the normal routine round, and 25% report during the PCR. This shows that 75% of patients did not benefit from the PCR, and still they were highly exposed to falls from bed. The second negative impact is patient found dead in bed. 40% of nurses acknowledge event of patient found dead in bed. And the third impact is bed pressure sores. In this study, 70% of nurses have encountered pressure sores on their patients in the ward. Yet, as we saw previously, PCR is not regularly done in this ward, meaning the bed sores are result of lack of enough change of position. And we can confirm again that the PCR is not well done. Does the patient comfort round affect patient satisfaction and nurse responsiveness to patient call? Yeah, we are saying in this study, 70% of patients said they are not satisfied with the care in general, and in particular, they are not satisfied with the PCR done in the ward. In connection with nurses' responsiveness, 22.5% of patients are not satisfied at all. 50% said the responsiveness is poor, meaning in 72.5% of patients, satisfaction is compromised. This one is my references, and from everything I've said earlier, what are the strategies to address ineffective patient comfort round? We said supervisor should verify performance of patient comfort round by staff, use of rounding log for documentation and direct report between nurses shifts. During the supervisor daily rounding process, verification of hourly rounding should be verified with patients. If inconsistencies are noted between the patient's experience and the rounding log documentation, coaching and mentoring must be provided to each individual staff. And we should avoid to be reactive. We should be proactive, meaning anticipate in our action before we see the consequences. Conclusion and future steps. This paragraph you are seeing there is just saying that in this study we concluded that the PCR is not well done in the TB.ward and is leading to some consequences, which are the patient are found dead in their bed, a patient falling from the bed, and the pressure sores that was discovered, and also the patient are not satisfied on the round that is done in the ward, and the nurses' responsiveness to their call is poor.